Again, thank you for being here. And it's my honor to introduce our first speaker, which is the United States Attorney for the District of Colorado, Cole Finnegan.
Good morning. I'm Cole Finnegan. I'm the United States Attorney for the District of Colorado. It's an honor to be here with you today with our partners in local and federal law enforcement to talk about fentanyl and to talk about the scourge that is becoming more and more dangerous to our communities, to the state of Colorado, and to our nation. Fentanyl is scary, fentanyl is dangerous, fentanyl is deadly, and fentanyl is changing everything. Together, we are taking dead aim at the criminals who make and distribute this deadly drug that is killing our children, it is killing our neighbors, it is killing families, it is killing people throughout our state. And we are focused on charging and prosecuting the criminals who are doing this to our community. Under the federal law, we have very direct authority and the ability to charge and prosecute those people who are in possession of a controlled substance or those people who intend to distribute a controlled substance. We also have the authority under federal law to enhance the sentences of anyone who is directly linked to the sale of fentanyl that is then linked to the death of a person. And in those instances, it's a minimum sentence of 20 years and it can go as high as life. So we are focused on that. When we talk about this and we talk about fentanyl, it can be very abstract, or we can have conversations about statistics. For example, in 2018, 108 deaths were attributed to fentanyl. By 2020, it was 540 deaths. In 2021, it's estimated that when all the numbers are in, it will be over 800. We can probably assume that it will be even higher in 2022. But I want to be specific for a moment. I think many of us in this room, and certainly many of the people watching, know people that have been affected by this. In my life, our family had a young man who grew up. We knew him since he was 5 years old. He was a close friend of my son's at one point. They were inseparable. And at the age of 32, he overdosed. And I want to just say that when you are with the parents of someone who's died at 32, it is hard. And when you see the grief that they are carrying and they will carry for the rest of their lives, and the agony this is putting them and their family through, it becomes much more real. It cuts through the abstraction of these conversations. So I just want to reiterate, as we go forward, working with all of these partners in local and federal law enforcement, it is our intention to do everything that we can to make it impossible for people to do this. We have worked on sentencing. We have had several cases already in which we have successfully prosecuted people who have been linked to the sale of fentanyl, to the deaths of innocent people, and we will continue to move forward in that regard. So I just want to reiterate and thank again our partners with the DEA, with the FBI, with ATF, our local partners, our state partners, everybody who is working together to prosecute and do all that we can as we go forward. In closing, I want to reiterate, in the U.S. Attorney's Office, we are devoted to the rule of law, and our mission is to protect the citizens of the state of Colorado and the citizens of the United States. And working with this group and others, we will continue to do so. It's now my honor to introduce one of our critical partners, the District Attorney for the 4th Judicial District, Michael Allen.
Thank you, Mr. Finnegan. I want to thank you all for being here today. The message we are sending to this community is important. The fight against fentanyl and the dealers bringing it into this community is truly a matter of life and death. The partnerships we have with our state and federal law enforcement agencies gives us the flexibility to appropriately investigate and prosecute fentanyl dealers, and I thank all of them for committing the resources necessary to combat the fentanyl epidemic. Over the past several months, we have worked closely with our law enforcement partners, including CSPD, EPSO, the FBI, DEA, ATF, and U.S. Attorney's Office to investigate and prosecute fentanyl dealers who are literally killing our friends and neighbors with their poison. Dr. Kelly's office has also been instrumental in helping us investigate overdose death cases. The toxicology reports that they generate with each autopsy provides the keys that unlock overdose death investigations. Fentanyl is quite simply the most dangerous drug on our streets today and is frankly the deadliest illicit drug society has ever faced. It is a powerful synthetic opioid that is commonly mixed with other illicit dangerous drugs or mixed with binders and pressed into counterfeit pills that by all appearances look like prescription drugs. It is 50 times stronger than heroin and 100 times stronger than morphine. 2 milligrams is enough to kill. Much less than 2 milligrams can and will kill children. In fact, an amount that can be held on the tip of a pencil will kill a human being. The statistics are staggering. In Colorado, we have suffered 1,578 fentanyl overdose deaths since 2015. That is an increase of 1,008% during that time frame. Overdose deaths in Colorado have led every state in the nation except Alaska, surging 382%. Nationally, fentanyl overdose deaths exceed homicides by 307%. In 2021 alone, more than 800 Coloradans lost their lives to this dangerous drug. The Centers for Disease Control now says that fentanyl is the leading cause of death among adults aged 18 to 45. Colorado has seen a 403% increase in the number of pounds of fentanyl seized on our highways between 2017 and 2021. Quite simply, fentanyl continues to flood into Colorado, and there are no indications that the supply of fentanyl will slow down anytime soon. Law enforcement agents on our streets are at risk every single time they come in contact with fentanyl because it is so deadly. As I said earlier, we've worked closely with our law enforcement partners to investigate and prosecute fentanyl dealers who have killed someone in our community. As Mr. Finnegan stated, the federal sentencing guidelines provide a much stronger sentencing option than do Colorado sentencing schemes currently in place. And we will continue to look for appropriate cases to take to the U.S. Department of Justice to prosecute dealers of fentanyl. Again, I want to thank U.S. Attorney Cole Finnegan for his committed and collaborative approach to this issue. I now want to specifically urge parents to be on the lookout for signs that your child is using drugs. No illicit drug is safe, and that has never been more true than today. If your child or loved one is using street drugs, they are at an elevated risk of death from fentanyl, and you might be the only person who can save their life. In 2021, 13,000 fentanyl pills were seized in one incident near the UCCS campus here in Colorado Springs. Be aware of what your kids are doing, even if they resist your efforts to be nosy. Look through their phones and their social media accounts. If you see references to blues, M's, M30s, or 30s, or other similar references, there's a very good chance your child could be the next victim of fentanyl. Fentanyl is an indiscriminate killer. A watchful parent or loved one might be the only person who can prevent that child from being the next fentanyl victim. Finally, I want to close with this, and this is a warning to drug dealers in our community. I want this to be a loud and clear message. Drug dealers who are dealing fentanyl in our community are not welcome here. We will hold you accountable for dealing fentanyl in this community. And if you kill someone with your poison, you will be prosecuted to the fullest extent of the law, and you should expect to spend an extended period of time in prison. I now want to turn it over to FBI Special Agent in Charge, Michael Snyder.
Thank you, Mr. Allen. Let me start by offering my sincere condolences to those who have lost loved ones to the scourge of illegal drugs in our community. For the past couple of years, narcotics overdose deaths have been the biggest public health crisis in Colorado, and fentanyl is at the forefront of this deadly onslaught on our citizens. Last year, more than 850 people died in Colorado after overdosing on fentanyl. It's almost a 60% increase from the year prior. And the number of fentanyl fatalities is climbing faster in Colorado than just about anywhere else across the country. The FBI Denver field office values our exceptional partnerships with law enforcement across the state, and certainly that's true here in El Paso County and with our Colorado Springs Police Department partners as well. And it's going to take this collaboration to have an impact on the fentanyl crisis. Along with the DEA and the U.S. Attorney's Office, the FBI has been and will continue to bring all available resources and expertise to bear to identify the traffickers and get the illegal drugs off our streets. We are committed to combating this deadly threat at all levels. While all of us know we are not simply going to arrest our way out of this problem, enforcement is one key facet to addressing this situation that we're all dealing with right now. Disrupting the drug trafficking organizations, both here and abroad, is a top priority for the FBI. To combat the supply of drugs into our state, the FBI's Denver Strike Force Squad is one of just 19 squads in the country that intertwines FBI special agents and intelligence analysts with other federal partners and local task force officers to target drug trafficking organizations whose deadly criminal enterprises have ties across the country and around the world. At the same time, we recognize that the lethal drugs like fentanyl are already here, and we will never be successful in completely stopping the flow of these drugs into our communities. Therefore, just like the recent investigation here in Colorado Springs, when tragedy strikes and people die, we will ensure that through our collaboration with our law enforcement partners, that a thorough investigation is conducted into the criminal elements that supplied the drugs and that justice is served. These fentanyl-laced illegal drugs are killing our neighbors. They're killing our children. We have tools to go after the people that are responsible, and you have my commitment. We will continue to do everything we can to stop these preventable deaths and the associated suffering that's taking place throughout our communities. At this point in time, I'd like to introduce Colorado Springs Police Chief, Interim Chief Adrian Vasquez.
Well, good morning, everybody. Adrian Vasquez with the Colorado Springs Police Department. I'd like to start by thanking all of the partners that are here with us today. We have a lot of federal partners. We have Dr. Kelly, EPSO, and we have Crime Stoppers and other folks that are holding a tremendous interest in this drug. The mere fact that we're all standing in front of you today should give weight to the lethality of this drug. I appreciate that our media partners are here also, because without you, the education piece to the public is not as easy. Getting the word out is part your responsibility. So thank you for being here. There have tragically been several juvenile deaths here in Colorado, and of course the weight of the juvenile deaths holds strong to all of us. I spent about 11 years in narcotics through my almost 27 years here with the Colorado Springs Police Department. I worked a lot of operations that dealt with a lot of different kind of drugs, and in my experiences through many years, I've never seen a drug that is so prolific on our streets that has such a lethal dosage. Fentanyl is an incredibly dangerous and deadly drug, with 2 milligrams being deadly. If we think about a sugar packet or a sweet and low packet, that is enough drugs, 1 gram, that can kill 500 people. That's tragic. Fentanyl is also incredibly cheap to produce and is being mixed with other drugs to make more money for dealers, and is almost always here in Colorado seen pressed into pills. As a result, many people think they're buying a particular drug, but in fact they're getting fentanyl. What you think that you're buying may not be what you think you're getting. The users, adult and children, are purchasing pills thinking it's safer, that it's a pharmaceutical drug, because as DA Ellen said, it looks just like something you would buy out of a pharmacy.
In reality, it's fentanyl pressed into pill form. There is no quality control. The pill made by a dealer may contain a lethal dose of fentanyl, and accessibility through social media and other methods make it relatively easy to get the drug. In Colorado Springs, one of the most prolific ways to obtain drugs are through social media sites like TikTok, which our children are using on a daily basis. There have tragically been several juvenile deaths, but this is an adult issue also. We've seen a tremendous increase in cases. CSPD's death investigations increased almost 150% from 2019 to 2020. In 2020, 40% of overdose deaths were fentanyl related. We saw a 10% increase from 2020 to 2021. This lethal drug here in Colorado and in Colorado Springs is here, and it's prolific and it's dangerous. So education is key. Be aware, talk with your children and talk with your loved ones. If you're using, seek help. Anybody who's using can seek out a police officer out on the street, and they can provide you with resources for assistance in recovery. If you see a firefighter, they can assist you with resources for recovery. Please walk up to them and ask for help. In short, please make our streets safer through education, and please make safe choices. Now I'd like to introduce El Paso County Under Sheriff Joe Ryball.
Good morning. As you've heard this morning, we are collaborating with many partners. We're taking this serious. This is our community, and we want to ensure our community remains safe and healthy. Fentanyl distribution and use in our community has exponentially grown over recent years. It has become not only a public crisis, but a significant challenge for law enforcement in the perspective of getting it off of our streets and bringing fentanyl distributors to justice. We are determined and committed to leveraging our regional, state, and federal agencies to combat this, but we cannot do it alone. We are urging the community to get involved. As you've heard this morning, families, loved ones, parents, you must get involved. Fentanyl has found its ways from the streets into our schools. It is impacting our youth. We are urging the community to work with us. We're sounding the alarm. Here this morning, each and every one of us are sounding that alarm. Get involved. Get involved with law enforcement and the prosecution. We are committed. We're asking you for that same commitment. Family members, educate your loved ones. Seek help. Urge your loved ones and educate them of the threat. If you find yourself struggling with addiction, seek help. For your next high could mean your death. That's how serious it is. And that's why we're committed. Thank you. It is my honor to introduce El Paso County Coroner Leon Kelly.
I'm Dr. Leon Kelly, El Paso County Coroner. For those media partners who are here who are local, unfortunately, you know, when I get invited to the party, it's not good news, and it certainly is true of today. However, we're not up here to be harbingers of doom. We're here as a call to action, and the hope is that this moment in time is the darkest before the dawn, and this is when our community and this collaborative comes together to make meaningful change. But make no mistake, our community, along with many others across this country, are facing a growing and formidable threat. In 2021, El Paso County, we saw a 22% increase in overall drug deaths from the previous year, which was driven in large part by the rise of fentanyl. In 2017, 5 years ago, in this community, we saw a total of 5 fentanyl deaths. In the last 5 years, we've seen a more than doubling of those fentanyl deaths year after year to reach our 21 total of 99 fentanyl-related accidental deaths. In addition to that, we had 2 fentanyl-related suicides, bringing the total fentanyl lives lost to 101. This rapid increase in deaths, as well as the young age of the victims, is what separates this drug epidemic from all previous waves of the opioid crisis. In 2021, we saw 5 children lost to fentanyl. ages 1, 5, 15, and 2 17-year-olds. The mean age of fentanyl deaths is 12 years younger, age 35, than the average of all other drug-related deaths. This shift to a younger population is due in part to the pill form that's easily trafficked and ingested, the widespread contamination of other drugs of abuse, fentanyl's high toxicity, even in tiny amounts, and its pervasiveness in the community, exposing even toddlers to fentanyl. In the majority of deaths, 55%, fentanyl was present with other drugs of abuse, suggesting clandestine contamination of other drugs, such as the total number of methamphetamine deaths in this community in 2021, 25% of those, a quarter of those, contain fentanyl. Unfortunately, these trends continue. As through the first quarter of 2022, we're on pace to eclipse last year's total with over 100 fentanyl deaths. 2 of those already this year are minors. This is a crisis that's, in truth, 2 decades in the making, and we have difficult work ahead. But this community has successfully navigated similar crises in the past, such as teen suicide, and we shall do so again. And with that, I'm honored to introduce DEA Special Agent in Charge, Brian Besser.
Well, good morning. I am new to Colorado, and I thank you for your time this morning. I promise I am the last car on the train. You've heard from a lot of our distinguished guests and comrades. You know, it's interesting. Many people use statistics, I say like a drunk uses a lamppost, right? More for support than illumination. And I want to illuminate a little bit this morning what I feel is the emphasis of the problem. If we could put the PowerPoint up just for a minute. I promise I won't kill you with statistics this morning, but I do want to kind of park for a minute and dwell on what I feel is the epicenter, the gravity of this problem. So we have an emerging threat. If you can see the slides, I'm not going to regurgitate what my colleagues have already stated. You understand in a basic sense what fentanyl is. You can see in this picture up here, we do have a penny. Roughly 2 grams of fentanyl is next to the penny, a potentially lethal dose, okay? Context is everything. The counterfeit pills that my colleagues have been talking about, as you can see in this slide up here, the counterfeit pills are virtually indistinguishable from pharmaceutical grade drugs. I have had the opportunity to work this burgeoning crisis across the United States for the last 6 years, intimately, foreign and abroad. Working against the cartels that are bringing them here, I watched this threat emerge almost as a grassroots problem here in the United States, where a lot of these pills were being manufactured here locally, not meaning Colorado, but locally in the United States. The cartels have ramped up their emphasis on this. Why? It's business. It's money. They don't care who dies. They just care about the money, the bottom line. But these pills are virtually indistinguishable. Who are they indistinguishable to? The soccer mom, your neighbor, maybe your kids. The mom who ran out of her prescription and she can no longer get it filled. She's struggling with pain. She doesn't know what to do. She drives to the street. She thinks she's getting a legitimate pharmaceutical grade pill, but she's not. She's buying poison and she can't tell. And that's when we find her in the park, passed. So the gravity of the situation is immense. This slide up here shows you legitimate pharmaceutical manufacturing center. That's what you expect to get your pills from. This is what we see in DEA. This is where these pills are being made. In scenarios like this, especially overseas, where our agents are constantly out there trying to interdict and destroy these laboratories that are making these pills. Seizures in Colorado. As this slide notes, drug dealing goes hand in hand with violence. Also goes hand in hand with overdose death resulting cases. I want to make a point. Steve, could you come up for a minute? I just want to make a point. I wasn't going to, but I brought a visual aid here. So here is roughly 20,000 pills, okay? 20,000 of these pills, roughly $200,000, $250,000. 2 years ago, this case in DEA would have been considered significant. The Front Range Task Force with DEA has seized 10 times this amount this week alone. This week alone, 10 times this. Now, if you come up here and take a look at these pills, and you can see how small they are. They're blue. They look like counterfeit oxycodone 30 pills. These are what's on the street. These are the very pills here. This isn't a gimmick. These are seized pills. You can see as they're divided up, each one of these pills, to me, is a human life. So let me show you something else. If you view this bag any differently than this bag, you got a bag full of bullets, then you are not understanding the gravity of this problem. Why do I say that? Each one of these pills, to me, is a loaded bullet. And I don't know when the hammer is going to drop or who it's going to drop on. Sometimes it drops and that person is very fortunate and lives. Many times the hammer drops and that individual dies right there. So I wanted to bring these here today to kind of articulate to you the gravity of this problem. As my esteemed colleagues have already noted, we're seeing a mass influx of these pills in the state of Colorado. 2 years ago, like I said, this would have been a significant case. I'm not saying it's not now. 20,000 pills is very significant. But if we are seizing 10 times this amount in 1 week at DEA, and that's just in the greater Denver metropolitan area. That's not the Rocky Mountain Division that I cover 4 states. That's just here. That's just what we've found. That's just what the undercovers, the detectives, the agents have worked to interdict. Imagine what we're missing. So I go to this next slide, and our administrator put out a public safety alert yesterday to the police chiefs, the prosecutors, because we've had a mass influx of nationwide spike in fentanyl-related mass overdose deaths. We've had 7 just in the last 2 months alone. 7 of those mass overdoses entail numerous people dying in the same place at the same time, usually from the same batch of drugs. What's interesting is we've had 58 overdoses and 29 connected deaths in the last 2 months across the United States with these mass incidents. Why is that important? Because 2 of those 7 incidents happened here in Colorado. 2 of them did. Many of these victims thought that they were taking cocaine, leisurely, enjoying it at a party, so to speak. They had no idea that they were actually consuming pure fentanyl. So I wanted to draw attention to that and note that these are the 2 instances here. You had Cortez back on March 3rd in Commerce City on February 20th. Many of you are already familiar with these. The media has covered that. But 2 of those 7, again, like I said, are here in Colorado. That is of significance because it lets you see, boots on the ground, it's here. Colorado overdoses, as my colleagues have already noted, we had roughly 1,800 drug overdoses in 2021. That's total drug overdoses. But as you can just see from the graphs, the spikes, I've never seen anything like this in 30 years of drug law enforcement. And I have bounced around between 6 or 7 states. And so this is extremely concerning to me. DEA stands ready with our partners. We stand ready to interdict the substances that are out there on the street. Our agents are out around the clock, nonstop. They don't look like me wearing a suit. They blend in. That's our goal. We want to find these substances, these pills right here. We want to find them, and we want to get them off the street. We also want to investigate the people that are doing it. I'm very thankful for the U.S. Attorney's Office's posture here. I cannot thank you enough for the DA's posture here. This aggressive stance on poison peddlers is absolutely essential. I'm grateful for it. The difference that we will be able to make, even if we save only one life, it will have been worth it. DEA wants to provide priority access to all of our resources, our chemists, our labs, the overdose subject matter experts that we have. We're going to be providing those to local law enforcement. And obviously, we want to do what we're doing today, which is warn the public. You know, it's one thing to see a picture, and I thought about this on my way over here. Pictures are a dime a dozen. You put pills on a table, and you show people what they actually look like, it's a different story. They're out there. Our kids are consuming them, and they may not have another option. I have worked countless deaths, just in the last 5 years alone. And so I want to put the emphasis where it is. Like I said, I don't want to just merely support what we're talking about. I want to illuminate what we're talking about. Why? Because we're talking about people. People. My greatest joy in DEA is not locking people up, although there are folks that do need that, right? Evil walks amongst us. The people that peddle this poison are evil. My passion is interdicting and intervening in people's lives and helping them before they have to enter the criminal justice system. And I know equally that is the passion of these gentlemen up here as well. So we open our resources up. I don't want to be any more long-winded. I thank you for your time. I thank you for your focus on this important topic. I'm going to turn it back over to the U.S. Attorney. And if we have any questions, I'm happy, as well as my colleagues are, to answer those questions.
Thank you. We should never take for granted what this collaboration is up here. This doesn't happen by accident. This happens with agencies and individuals who truly want to make a difference. So I'm so proud to be a part of this incredible group. With that, we'll take questions. Are there any questions? Yes, sir?
Can you tell me what you're doing new? I get it, there's collaboration, other new programs, other new task force. What are you doing new?
The news here is that and this is something that I can address later, separate from this group. But the news here is that we're working very hard, hand in hand, both locally and federally, to make sure that we're prosecuting appropriately the people that are putting this kind of stuff out on our streets, killing our kids, killing our friends, killing our neighbors. That's what's new about this particular initiative. And that is that we have this partnership. We have these great relationships in place. And the U.S. Attorney's Office is gracious enough to help us deal with this local problem and get these people off the streets. That's what's new. Currently, and I can talk more about this later, but currently state law does not allow us the same sentencing flexibility that the federal system does. And so we want to make sure that the people of this community understand that we do care about these cases, that we're effectively investigating these cases, and that we're working with all of our partners to make sure that these cases are effectively prosecuted and people are put in prison where they deserve to be.
Do you expect to take more federal cases? Do you expect to take more of these cases, not just the Colorado Springs? I'm Matt Devil, which I'm on Devil. Do you expect to take more cases statewide on federal level?
Yeah, your question is, do we intend to take more cases? We work very closely with our local partners, and we have a couple of our prosecutors are here today. We work with district attorneys throughout the state, and in those instances where it makes more sense for the federal government to step in and prosecute, we will do so. As I said earlier, we have the authority and the ability under the federal statutes to charge and prosecute people who are in possession of controlled substances and who are in possession with the intent to distribute, and we will do so. And in cases where we can enhance the sentence because the sale of fentanyl or a controlled substance has resulted in the death of someone, we will do so. So to the best of our abilities, we will certainly take those cases where we can, working with our partners. I also want to just reiterate, you asked about news. This is a public health and a public safety crisis we are battling, not just in Colorado, but across the nation. So I think all of us understand that we have to come together and communicate and be as direct as we can with the public that we have crises that are happening here. We have public health crises and we have a public safety crisis. And all of us have to work together to battle against this. So thank you.
Other questions?
Sydney from KRDO. I'm wondering why now? The deaths have doubled every year in El Paso County since 2017, I believe. So why now? Why are we coming together now? Why wasn't this serious enough a year ago?
So I would suggest to you that a year ago was also too late, but also that these partnerships have already been working on this longer than a year ago. We are just now announcing this to the public because it is becoming such an epidemic that we want to make sure that people understand, one, the dangers. If they see that their loved one is engaging in these behaviors that are putting them at risk to fentanyl, that they understand what these drugs look like so that they can intervene if they need to, so that people that are actually users can know what this drug looks like. I think that that's been a big deficit on the knowledge front up to now, right? People haven't necessarily, the general public hasn't necessarily known what fentanyl-laced pills look like and how often they're encountered and how many of these pills are actually out on the street. It is literally flooding into this state. And so it is imperative on all of us to make sure that we're getting that word out. The idea that it's just now being done is not necessarily accurate because it's been happening for a long time. We're just now bringing it to the public.
Can I chime in real quick, too? To the district attorney's credit as well, I want to note one thing. The cartels have shifted their production dramatically just within the last few years. This is key. Organic drugs, heroin, cocaine, they're very costly to manufacture. Lots of manpower, hectares of land. You have to take a lot of precaution to evade law enforcement, right? That all changed with the advent of fentanyl. Because now I can put one guy, a chemist, in a room, very small room, with just a few people and some precursor chemicals and manufacture this deadly poison, and no one knows. I can't tell you how many of these manufacturing operations I've personally seen in hotel rooms. And you don't even know what's going on next door to you. So my point is this. These pills, the mass influx of these pills has really started to proliferate just over the last couple years alone because the cartels realized the money that is in this. Remember what I said? This is roughly $200,000. And that's what I call bargain prices. You know, open borders right now, so open prices. Now, the issue is when the prices start driving up, and these become $30, $40 a pill, like my folks up in Billings, Montana, they're paying $30 a pill. Do the math. You're talking millions of dollars. So it's just pragmatic business sense from greed-driven and profit-driven enterprises. But the influx we're seeing now is completely different than what we saw 2 years ago, completely different. They are just overloading the border. We have a fentanyl-saturated society right now because it's all money. And I think it's important to note that. I think we're all still trying to catch up to the train, so to speak, and the threat.
I have a question for Mr. Schneider and Mr. Besser.
Can I just go ahead and just say one more thing on this? One of the important things, and I sort of started talking about it, all of the things that we would say about the influx of the drugs is incredible, and we're seeing our increase in cases, we're seeing our increase in overdoses, Dr. Kelly has talked about, but I also don't think that we can educate the public enough. I don't think we can talk about this enough, and so getting the word out through every resource that we have available, and this is a great demonstration of what it looks like now. I think the public needs to see that as often as we can because we cannot have a single more death, especially our children are getting it in manners that we've never been or that weren't accessible to them many years ago. And we've got to slow that down and we've got to educate the public on this crisis.
Sorry, a question for Mr. Schneider and Mr. Besser. Can you tell me if DEA and or the FBI are you doing things differently now? Are you adding resources, people, equipment? What are you doing differently now or have been doing the last few months in terms of enforcement efforts?
So I will speak initially for FBI here in Denver, and then certainly turn it over to my counterpart for anything he would like to add. I will tell you, as I mentioned in my prepared comments, the strike force concept that we've created here in Colorado is unique. The fact that I have an FBI squad that is co-located with DEA in DEA's facilities. We commingle with other federal law enforcement agencies and with our state and local partners, and we're working collectively in a very coordinated manner to address this issue. There are only 19 such places across the country where we're doing this, and our strike force here is one of the most productive across the country. So that is very unique and is just directly related to the threat that we see in our AOR.
How long have you had that?
That's been in existence for about a year.
I want to say thank you to Mike for dedicating many of his precious assets and resources to us. What are we doing differently? I'll tell you, there's a three-pronged approach, at least in my opinion, that we stand on. Number one is comprehensive, cooperative, and aggressive law enforcement action. We use any and all means, not just conventional means, but any and all means to try to identify these people that are pushing this poison. Why? Because there's human lives at stake. I can tell you that my guys, his guys, we're working around the clock, literally. And when I say conventional law enforcement means, I also mean non-conventional. We have wiretaps. We have surveillance. We have undercovers out. If you saw or heard what I hear, the hair on the back of your neck would stand up. And I'm not saying that, with hyperbole. It's very concerning. Second prong is dealing with our healthcare, our treatment, our prevention providers. My dear folks that are in the trenches right now trying to help the human aspect that I just spoke about, right? If we can get to saving a life before people are actually ingesting the drugs, that's a win. So healthcare, diverted drugs, 80% of the heroin users that I dealt with when I was stationed in Utah a couple years ago all started with prescription drugs. So if you don't think these folks that are seeking these pills out, that they stop with pills, of course they don't. If they can't afford the pills, what do they buy? Heroin, because heroin's cheaper. So that's out there. The third leg is community awareness, which is exactly what we're doing today, is getting it out there. I have literally stood at countless press conferences in the last 5 years alone on this topic, ringing the bell, beating the pots and pans in the kitchen, trying to get people to pay attention to what's going on. Now people are starting to pay attention. Why? Because kids are dying. It's in the schools. It's at the park. I worked one case, and we did a segment on American Greed that aired back in February, one case that I worked, where one guy, one millennial college student, was manufacturing millions of pills and disseminating them to over 8,000 package recipients across the United States. One guy, locally, right here. And those pills were going to college campuses. Where do you think they go at that point? So community awareness is absolutely critical. Law enforcement, dealing with our healthcare community, and obviously community awareness. Those three prongs, sir, are really what we're trying to drive to right now. I want to put a quick shameless plug in for DEA's One Pill Can Kill resource right now. Because this problem has become so egregious and we are flagging so many questions, parents don't know where to turn. So we have a One Pill Can Kill resource on DEA's website where they can go in and say, okay, what is fentanyl? Let me tell you what that is. How are the pills made? What do they look like? What do I tell my kids? How do I show them what to look for? Those resources are there, and we make them readily available for everyone.
Okay, two more quick questions.
Yeah, Sean Rice here from KRDO. A question I had is, how much do you guys think this is rooted in legislative action or lack thereof during this latest legislative session? And do you guys believe they are listening earnestly to you guys and your latest pleas in these last couple of months for change?
So why don't we do that one offline from this, okay? Just so that we don't cause any trouble with our federal partners.
Okay, one more. Thank you.
Hi, Angela Rose from CASA. I'm just wondering what efforts are being made to get it into the schools, because it is affecting the kids, and I think that's where we have to get the message. All the parents aren't going to tell their kids.
So I'll go first. We're actually in the planning processes. Howard is working closely with our local media, and we're going to have a town hall event fairly soon to get that message out to parents and into the schools. It's fairly often that I go to schools myself and talk about different things, including drug usage, and getting things like this in front of kids so that they can know what this looks like is going to be very important going forward. I can't stress enough, and all of us have said it, fentanyl is flooding into this community, and it's not slowing down. It's in fact picking up, as evidenced by the demonstration from our DEA partner. And so the idea that we need to be even more vigilant from a parent perspective, from a loved one perspective, is very important. So the idea of getting into schools hits right on the money on that, and hopefully our town hall that we have coming up will help with that effort too. But it's important that the community knows too, so that they can spread the word about what fentanyl looks like and how deadly it is. So thank you for that question.
Thank you. I know here locally, law enforcement, we have school resource officers that are in the schools daily, and they educate the youth and the staff there. Recently, we had a case that involved a school resource officer trying to intervene with a specific incident. So we do have resources every day that are in our schools, both us and Colorado Springs Police Department.
Okay, thank you all for attending. And if you want to do some sidebar interviews, you can connect with myself. Deborah is over there, and Vicki is here from the FBI. Cool, thank you.